everybody. It is rather late on Wednesday evening. I'm Dr. Jordan Leasure. I'm the owner and physician of North Shore Proactive Health, a state-of-the-art wellness clinic in the northern Chicago suburbs, and we are in stress management boot camp. We have a little bit of an odd setup this evening because my phone wasn't charged, so I had to be near an outlet, and my husband is working fixing some servers, so I got demoted from the office to the kitchen. So this is where we're chatting this evening. So we're going to talk about optimal lab results today, but it is late, and that is too in-depth of a topic, I think, to cover at 9:30 at night on a Wednesday. So instead, we're going to go over some questions that I've received privately and talk about what my days look like, how I implement everything that we've talked about, and just answer random questions that come up. Hello, Claire. Thank you for tuning in. So my biggest priority, for those of you that don't know, I have a 3-year-old. I have a very social 3-year-old. And my biggest concern right now, of course, I own a brick and mortar business. I have employees. They are a big concern. Survival of my business is a big concern. But my biggest concern is the emotional health of my toddler. So what do I do to ensure that he is safe and happy and healthy? Is I do what I have been preaching for the past few weeks, is I make sure that I take care of myself. Because this is a very scary time, and it would be very easy to stay in bed and to curl up and stay worried about what our future looks like as a country, what my professional future looks like as a business owner, what our individual rights look like. There's lots of what ifs out there right now. And instead, I am just gonna make sure every single day that I am well taken care of so that he is well taken care of. What does that look like in practice? So every day we make sure that he is still getting to bed. Ideally, even if we start bedtime at 7:30, which is what we like to do, he may not fall asleep until 8:30, and with it staying later longer, that's becoming a larger problem for us. We just moved into this house a few months ago, so we don't necessarily know what our light management is yet. And then he is up at about between 6:15 and 6:30 every day. I am usually up at 5:30 so that I can work out and be done with that before he gets up. Now, what does that look like? I want to be as specific as possible for everyone because I really do think that this is all really important. So I make sure that I work out every single day, which I wasn't doing. But for those of you that don't know, my mother was kind enough to purchase my sister and I each a Peloton. And we did it at a time where she ordered it and it was received by us within a week. So I've had that, I think, 10 days now. Maybe more. I'm on my 3rd week of working out with that, and it's amazing, and I do it every single day. And I think that is key to my emotional well-being. And of course, not everybody has exercise equipment at home, but there's so many things that can be done with body weight, and there are so many free resources. My girlfriend's gym, if you check out Fly Girl Fraternity, all of their staff are teaching their classes from their homes. So you may see somebody's basement, they may be teaching a class on the porch. Kim is still doing classes from the gym. So you can do their classes, you can watch them on demand. You can be doing work with foam rollers, you can be doing work with stretch straps, and that may be something that we do next week. If you guys think it would be beneficial, give me a thumbs up, give me a yes, I need stretching guidance, I need strengthening guidance, because I'm happy to teach a class from the office. I'm happy to teach some functional movement that may help along with improving your ergonomic setup. So that's what I make sure that I do, is I'm working out every day. And I'm also, and this may sound redundant or it may sound common sense to some people, but I'm taking a shower every single day. I'm doing my makeup every single day. I'm getting dressed every single day. You know, I've seen a lot of memes going around about, you know, I changed my day jammies for my night jammies, and I don't think that's helping our emotional health. You know, this quarantine is not a vacation. It is not a, you know, recreation. And if you need some time and, you know, that's your relaxation, you know, maybe that's okay, you know, for a weekend to unwind, to unplug. But it is my feeling that in order to maintain your emotional well-being, you need to be taking care of yourself every single day, and that includes getting ready. Literally, only if it's getting ready for yourself. You know, you're gonna go for a walk and you're gonna look damn good on your walk, but I think that's what needs to be done. So then we always get up. Will's been making breakfast the majority of the time, but we'll have breakfast together. And then he starts working. Obviously, he's working from home like everybody else. He's in technology, so for them, honestly, nothing has changed. And so he's usually working by 8:30. So that means typically we are done with breakfast, and Parker and I are working from home, schooling from home, all of the above, from about 8 o'clock on. Now, Parker takes his own supplements, and I have talked about this a couple times. In my water, I'll usually do 40 ounces of water, and this may, again, seem redundant for some people. This may seem in-depth. This may seem overboard, but everything that I do is very deliberate. Every choice that I make, and it has to be like that, or there will be an unraveling, and I will be on the couch with a bottle of wine and binge watching Homeland, which I'm almost done with. And I started over during quarantine. So I'm very deliberate in my choices. I'm, again, drinking about 2 of these while I'm doing my Peloton in the morning. And I'm not doing an hour ride, I'll tell you that. When I get done, I'll fill this up again. And I do collagen for my 40-year-old skin. I'll do Relaxed Life for my COVID brain, I'll call it now. And then I'll actually also do powdered greens. So this is a powdered green supplement. It's 10 servings of antioxidants in every scoop. I also put this in when Parker wants a milkshake. It's a smoothie. I put it in the smoothie for him. So all of us are getting our antioxidants every single day. I have, and if you've been watching the videos, you've heard me complain or you've seen me rub my neck. I've had a pain in my occiput right here since prior to all of this starting. And I'm blaming it on my massage therapist not being able to work. But all jokes aside, in the office and online, we sell these little things. If you can see them, it's called an AIP pack. And I took them all, so there's none left. But it's a combination of proteolytic enzymes. There's a little bit of magnesium. There's some turmeric in there. It's for acute pain. And AIP stands for acute pain and inflammation. So I was taking those 1 pack a day for 9 days to try and work on this. And I think I'm going to get myself another pack because it still hurts. I use some essential oils on that as well. So I use peppermint topically because that helps to decrease pain. It's cooling, obviously, it's peppermint. That's my side thing. So maybe we'll talk about oils, but we're going to talk about my standard day. So for Parker, all of us should be taking omegas. If you're not taking omegas, especially now, it's great for cardiovascular health and for brain health. I give that to Parker. He does a teaspoon every single day, or else I'll put it in his shake. You know, for me, I do it straight. It really doesn't taste like anything. Anybody that complains about the taste of a vitamin, I will tell you that they are meant to be vitamins. They're not meant to be chocolate shakes. So they're not going to taste amazing. And if they taste amazing, there's probably stuff in there that you don't want to be taking. So it's a vitamin. With meals that are containing high doses of protein, usually that's lunch and dinner, I do my enzymes. So that's what enzymes look like. They're meant to help break down our food so that we digest it better as we age. It's scary to think. we lose some of that ability, so I'm helping myself. I give Parker enzymes as well when he's eating. He calls it his medicine, which I hate, but he can't say supplement yet, so we're working on it. And then, obviously, with everything that's going on right now, I'm doing very high doses of antioxidants. So I'm doing NAC, which you've heard me talk about a million times. The Institute for Functional Medicine has recommended that as well. Vitamin C, same thing. I'm doing 1,000 milligrams 3 times a day. Zinc, also. Make sure if you're taking zinc that you're taking it with food, otherwise it's going to give you an upset stomach. I do probiotics. These are a powder. And this is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. I should know. This is 12 different strains of bacteria. It is 25 billion CFU per, no, so it's 100 billion per quarter of a teaspoon. So that's the big dose that we do. In the office, we sell like 6 different probiotics. So there's a powder, there's a capsule, there's a chewable toddlers, there is a powder for babies, and then there's one probiotic for weight loss, and there is one probiotic that does not need to be refrigerated. It's in a blister pop pack. So that's the rundown on our probiotics. Then I'm also doing extra turmeric, again, because I'm hurting, because turmeric is anti-inflammatory. So what is missing here? My vitamin D is missing. That's a liquid dropper. It's vitamin D with K. I'm doing 10,000 IUs a day. And then magnesium before bed. I'm doing about 300 milligrams of magnesium before bed. And those are kept upstairs in my bathroom, so that's why I don't have them down here. So why are we running through this? That's kind of what my day looks like prior to 8 a.m. And I think it's important, you know, after that, I may be seeing patients, I may be working on our website or blogging, or simply, again, my main issue is taking care of Parker, making sure that he is occupied and having fun and doing different things. Sorry, I'm drinking ginger tea and it's a bit spicy. So your day is obviously going to look differently than that, but your priorities should be similar. So your priorities right now need to be yourself, putting the mask on first, and then taking care of everyone else. And depending on how concerned you are with the virus, your protection and your proactive activity needs to be serious if that's your concern. Staying home behind a locked door is not the only answer. We are exposed 24/7 every single day to an onslaught of viruses and bacteria and germs and microbes of all kind. You need to be proactive. You need to be protective. You need to make sure that the soil that is you is strong enough to combat anything that gets thrown its way. And the recommendations that are out there right now, I don't feel are excessive. I think it's easy to be compliant. Again, full disclosure, I own a supplement company. The reason that I did that was because the products out there, the options for buying vitamins are infinite. You can buy a year's supply of turmeric or magnesium from a big box store, where you can also get, you know, if it's in stock, a year's supply of toilet paper. You can order online, and the quality does not compare whatsoever to buying a vitamin from a provider, from a physician grade, and again, that's a marketing term, independently tested and qualified, and I don't know what what if ours say everything that they go through in order to be allowed to be purchased. But my caveat to you would be, if you are being proactive and it is your goal to protect your family and do what you can, and you think that you're taking vitamins and you're taking the dosages that I recommend and all these things. Hey Casey, thanks for tuning in. Please make sure that you're taking a high quality product so that you're not being duped into buying a, container of sawdust, which they have done studies, they've done independent studies of, and again, I don't want to throw any stores under the bus, but it starts with W, and a lot of people fill their prescriptions there, and they pulled 10 samples of vitamins off the shelves, and of the 10, I don't think any of them contained the doses on the back of the product that they were supposed to. And that is very scary. So, as always, do you need to buy your stuff from us? You don't need to buy your stuff from us. There's a million physicians out there. I have incredible colleagues. And would I like you to buy your stuff from us? Absolutely. Because then I know for sure that what you're getting is safe. I know that you're getting what I give my son, what I take myself, and I can better advise when there are questions on dosages. I can tell you no problem. I can tell you off the top of my head. When you're taking something else, I don't know for sure. We have access if there's things that we don't carry. We started giving access to a company called FullScript. So if any of you are familiar with that, if you use that, you can use that through a lot of different providers. And I can't really see, I have this light in here since I'm in the kitchen. Do we have vitamin C available? Yes, we do have vitamin C available. We have vitamin C available in capsules, which is what I take. And we also just got, and I think we still have some in stock, we have liposomal vitamin C, which in studies, that's actually absorbed better. I'm just sort of a creature of habit, so I've been taking my 3 vitamin C 3 times a day, and that works for me. Liposomal vitamin C is it's almost the consistency. Jade, if you're still on here, you can chime in. It's a consistency of like, I don't know, like pudding is too thick. It's like a gel, and you can put it in water. You can do it straight if you want, but you can put it in water and take it that way. And because it's emulsified like in fat, then it's absorbed by the body better. So that's been very popular lately. Yeah, we have everything in stock right now. I think the zinc is the only thing that we do not literally have on the shelf, but it might be in the office tomorrow. Because, and again, we're very fortunate with my background. As soon as this started happening and there were rumblings of, the virus being a bigger concern and them literally shutting things down, in my mind, I recognized that everybody I knew, and honestly, I just stocked up because I knew how much my family was taking, and I wanted to be prepared. I didn't want to be sold out. And so we stocked up, and so we were fortunate enough to have enough in stock for patients. And I reorder, instead of reordering at our normal rate, I reorder ahead of time so that we're able to refill on a more regular schedule so that we don't run out. The remainder, I would say, of my habits, include eating healthy, planning meals ahead of time. We've eaten out a little bit, and by that I mean ordering from some of our local vendors, and we do our best to make healthy choices. We're not drinking. I think I've had alcohol like maybe once every other week, and again, that's a deliberate choice. Alcohol is inflammatory to the system. One of the talks that I watched this morning was on the mechanism of action of the virus, and I know I kind of said we weren't going to discuss the virus in this group, but here we go. So the mechanism of action of the virus is inflammation. So the best thing you can do to prepare yourself is what we just talked about. But also, if you are found to be positive, is to literally do, and I think the speaker used the term fistfuls of antioxidants. And the studies have shown that of the people that are getting this, are positive for this COVID, about 20% are the ones that need assistance. 80% are fine at home. They're sick. It sucks. It's not necessarily like the flu. It's rough, but they manage at home without interventions. The other 20% are individuals that should be monitored, and less than 5% are the ones that need severe attention. And what severe looks like varies by the person. What is consistent among all of those severe cases are that there are individuals that have other comorbidities. And what does that mean? That could be everything from asthma to cardiovascular issues. The reason that they put the blanket age 65 is because, as we age, especially in America, our health doesn't necessarily improve. So the incidence of someone being over 65 and having comorbidities is pretty high. So it's important, if you fall into that category, to be very deliberate and treat this very seriously and increase your antioxidant intake, decrease your stress. Take these videos that I do as a prescription and follow my recommendations to a T. Again, the memes of drinking and the shopping carts full of wine and the moms posting like, we had a hard day at school, when's okay to have a drink, and the responses are, well, it's, 5 o'clock somewhere. That's not funny, because we're literally shutting down our economy in response to this virus. And my goal is that, if we're going to be that serious about what is attacking us, then you need to be that serious in mounting your attack. And your attack needs to be being proactive in your health choices, and that does not mean sitting at home like you're on vacation drinking wine. You need to be managing your stress. You need to be meditating. You need to be keeping your gratitude journal. These are very, very easy things. They don't take any equipment. They literally don't take any time, like 2 minutes. Taking your vitamins. No one should be losing their pocketbook over supplements. And if that's a concern, call me. There are options. We offer 20% off at the office if anyone spends over $200, and that may seem like a lot, but get a friend together and place an order together, or order 2 months worth. I have a lot of patients that do that. And the other option is to eat healthier. So we are going to do a meeting on meal planning. And I don't know how many of you have downloaded, I haven't checked lately. There are free resources, free, F-R-E-E, on the Salutogenic Life website. The first drop down under shopping is meal plans. So there are free resources on there. There is a free meal plan for stress management, which I think we all need. There are shopping lists on there, and there are recipe books, and there are literally the meal plan itself. So there's no excuse to not be eating healthy while you're at home. And if finances are a problem, or time is not the problem, or any of that, again, let me know. If it's something different and you have individual concerns, or you have food allergies, or if you have something like that, we literally cut down our prices as low as possible. And we're doing personalized plans for under $20. And that is you emailing me and telling me, you know, we're gluten-free and we're dairy-free, and I like to eat salmon, and I would like it to include pine nuts. And I'll put together a week-long program for you. Same thing, of a shopping list and recipes and a meal plan. So you can print it out, you can put it on your fridge and say, this is what our week is going to look like. If you want to do a plan that is, what else is on there? I think there's stress management on there. There is a vegetarian one on there. So if you're looking for ways to save money, eating vegetarian is a great way to do that. You could try doing that. There's lots of opportunity. So take a look at those and utilize these resources. And if there's something missing, or if there's something that works for you, it is your job to contribute in this group and help everybody else to make sure that they are happier and healthier, because this is rough for everybody. It's just a different type of rough. And we all have different times that we excel. So if there are not any other questions, I will leave you all with that. Those are my rantings for this evening. So the things I want to cover in the next handful of days, we are definitely going to cover what optimal test results look like. We're going to go through a meal plan so I can show you step by step what that looks like. And if you're saving money and you're not purchasing vitamins and you really want to get your nutrition from your food, you need to be making smart choices. You need to be having those 9 servings of fruits and vegetables, like I mentioned. What else are we going to talk about? Maybe we'll do some movement. If you guys would find that beneficial, we can do some functional movement. We are going to talk, there was another one, now it escapes me. But let me know how I can be of a resource. Again, you can send me a private message. I got these questions, so I thought I'd put them together, and just let me know how I can help. Let me know if you're struggling, where you're struggling. Let me know where you're excelling and where you see things going. Will was just told today he's working at home through August, so that's exciting. That's interesting. We'll see how that goes. And I think every single day there's new developments for all of us. We just got to figure out how we're going to make it. Let me know how I can be of assistance. And again, please share. This is a resource for all of you. And if there's anything that you need, I'm sure there are people in the group that would be happy to help. So have a beautiful evening. I'll see you tomorrow. Today's hump day. Tomorrow's Thursday. We got 2 days left to the weekend. And we'll see you then. Bye-bye.